Okay, I'm delighted to say that we have been joined today by Councillor Rob Polhill, the leader of Halton Borough Council. Councillor Polhill, thank you so much for taking the time to talk to us.
Fine, smashing. Thank you.
Welcome to the Healthy Blog. Before we talk specifically health, tell us a little bit about yourself. Tell us a bit about your role.
Well, started off as a ward councillor in 1988, and in 2010 I was elected leader of the council. I chair the Halton Strategic Partnership and I chair the newly formed Halton Health and Wellbeing Board.
And is it a role you enjoy?
I do, yeah. If we didn't have all these cuts, I must say, I think I'd enjoy it better.
Right. I suppose in a time like this is the time that you can do the most good, in a sense, isn't it? Because Halton really needs people like yourself who've been here a long time and are working hard to keep the borough going.
Well, yeah, I think local matters, and I think people with local knowledge matters, and that's why, you know, it's so important to have the voluntary sector like yourselves who work in the community to be involved. So I think it's good to have that local experience.
Cool. And as I said, this is the Healthy Blog, so we are concentrating today on health matters, and you mentioned that you're chair of the Shadow Health and Wellbeing Board. Now, the health framework is changing nationally and locally. What does this mean for Halton?
Well, a new beginning, I would have liked to think. The PCT is being dismantled, as you know, taken over by Care Commissioning, I think, Care Commissioning Group or something like that.
Clinical, something like that. Yes.
There's a lot of acronyms. Which is need to get
there are a lot of acronyms.
But I think that what it does do, it does give the council a role now, a more strategic role in health matters. And what that does is we are able to bring a lot of agencies together under the guise of the Health and Wellbeing Board. And I think that in itself makes it sort of something different.
And I've been lucky enough to attend some of the Health and Wellbeing Board meetings. There's an awful lot of different people around the table, a lot of professional expertise. It's just quite exciting, isn't it?
It is. I'm keen that we get people around the table. It's just not a talking shop.
Yes.
I'm very keen that people are there to act, and action speaks louder than words. I've always thought that. And so I believe that we've got the right people around the table to make that point. What I always say to people is, if you can't make a decision around this table, if you have to go all the way and think about it or discuss it with someone or all this kind of, well, you shouldn't be around the table. We need to move on with this.
Absolutely. So, is there a role for the voluntary sector within the Health and Wellbeing Board?
Absolutely. The role of the voluntary sector is important because, as I said to you before, it's the local knowledge. A lot of people in your street do just volunteer work and this, that and the other. So it's how the voluntary sector themselves get together to channel that information, so that whoever sits around the table, as you know, we have a person on the Health and Wellbeing Board, which is Sally Ormond, who is the Chief Exec of the Voluntary Community Action, and I think that it's her role to tell her message for what's being fed back to her from the local people, and that is important to me. That we know what's happening community-wise, because this isn't just strategic. This is not national. This is Halton.
And I suppose that idea, Sally feeding out to the voluntary sector, and maybe she can collect evidence and good practice within the sector to feed back to you guys as well, because I think there must be tons of voluntary projects that are helping improving the health, so to speak, of people in Halton.
Well, there is, and we've had that feedback, and so that's why it's quite important for us to have the voluntary sector there.
Great. What are the local priorities for health in Halton?
Well, obviously we're working on that, and we've got I think it's called a joint assessment needs strategy that we're looking at, and people's feeding into that. But obviously cancer's a big one. Smoking's another one. Teenage pregnancy is another one. Obese. We've got a lot of obese children that we need to try and sort out. That's what they're saying. But I mean, all these are issues that we have to address, and we are addressing. And we've just recently had a presentation by the Director of Public Health. Ian O'Meara, who's been around to each area forum or on the way around, telling what our targets are and what the stats are showing. And this seems to be one of the problems that's there.
Is this new for the council to feel? Was health previously, did that belong to the NHS or the PCT?
I think it did.
Yeah.
It did, and you sort of you dipped into it. But if it was to be perfectly frank, they took no notice of what the council was saying. Right. And yet it's the council that deals with the day-to-day problems.
Yes.
I've got to say I'm very heartened by the GPs.
Terrific.
That's come along and getting involved with this, and the people from the health side now who sees this as a new dawn.
Yes.
And they're actually getting in there and getting stuck in. So I'm really, really heartened by that. And there's a sort of an enthusiasm that's saying, let's get this right. So I'm pretty chuffed about that.
Fantastic. And do you think long term that the voluntary sector organisations are going to be able to be commissioned to provide services?
I think that'll be down the track somewhere.
Yeah.
And I think that it's not, something that they won't think about. I think that's very much on the radar.
Yeah. You said at the start you've been a ward councillor since 1988. This kind of joined up approach where you got what used to be the PCT, the NHS, GPs, voluntary sector, and yourselves here. This must be must have been very different in the old days. Is what I mean by the old days, the 80s, with everyone working in silos, so to speak.
Well, they had. I remember when before I became on the council, I was a member of the CHC, which is Community Health Council. Right. And that was like the watchdog, if you like. We now have Links, which is the watchdog. Again, a voluntary sector.
That's right.
Which looks after that. And it's going to go to, I think it's something called
Health Watch. That's correct.
Which will be transformed over, and Health Watch will sit on the Health and Wellbeing Board. Yeah. Yet it was a bit different then. We did. Governments of all colours keep changing the rules about patient precipitation. Yeah. But I think that I think we've got that slot there for Health Watch to be on. And so, it's changed. It's changed quite a bit.
So as a final question for you, how optimistic are you about, I mean, there's a lot of challenges regarding health, and you outlined some of them before, but how optimistic are you that with this joint approach we can make a difference in Halton?
Do you know, Matt, I'm really optimistic about it. I mean, I'm the last one to go to the doctors, and I'm telling people this is early prevention and things like that, but they frighten me to death, I've got to be honest with you. But, I'm so encouraged by what people are saying that I think we can make a difference. It's going to take a couple of years, quite a few years, but I'm sure we can make a difference with this team we've got there now.
Brilliant. Councillor Polhill, thank you for your time today.
Thank you. Cheers.